It has been 6 weeks since 4 people died in Goldsboro in 4 days. More than a dozen others across eastern North Carolina overdosed around the very same time. Families, community members, and law enforcement have been searching for answers about what caused these deaths. Tonight, WRAL investigative data journalist Ali Ingersoll has new details about what was in the contaminated supply.
What was sold as illegal fentanyl wound up being a mixture of 8 different drugs.
It was a particularly nasty mix of substances that involved fentanyl and xylazine, but also a very potent benzodiazepine, a hallucinogen, and another kind of designer chemical.
That's Dr. Navarun Dasgupta, a senior scientist at the UNC Street Drug Analysis Lab. They have a partnership with dozens of public health organizations, including Edgecombe EMS.
This was pretty eye-opening for sure for us. When I saw the results, there was a number of things that I'd never seen before in Edgecombe County per se, and it didn't really make sense as far as the mixture.
This is their second attempt at trying to identify what was in the supply. This time, the sample came from a bag stamped with a certain design. What's particularly unsettling, a few months earlier, Barrett had samples tested from a different bag with the same stamp, and the results came back vastly different.
Usually we try and think about these stamps as like labels on a beer bottle, like this is Michelob Ultra, this is this, and it's like the same thing time and time again, but that's not the case.
Barrett says he will now take this information to the community, hopeful that knowing a mix like this exists will raise awareness and save lives.
Seeing people of my age dying from something that we can prevent really kind of tickles my heartstrings as a medical professional.
For WRAL News, I'm Ali Ingersoll.
With the variety of drugs in the supply, Ali wanted to know, would naloxone have worked to reverse that overdose? Both men said yes, but they probably would have remained unconscious just because of how potent that substance was.